Face-to-face clinical rotation of clinical clerks and medical interns will continue amid the new quarantine system. Let's talk more about this with the Commission on Higher Education Chairperson Prospero De Vera. He is joining us via the line. Sir Prospero, good afternoon.
Hi, good afternoon, and thank you for having me.
So, De Vera, first off, have you already issued new guidelines and can you walk us through with it?
Well, what Secretary Duque and I signed the other day is guidelines so that the students are doing their clinical internship in hospitals, even in ECQ and MECQ areas, can now continue with their clinical rotations because what was approved early this year for limited face-to-face is that it is only for MGCQ and GCQ areas where students are sent to COVID-19 hospitals. But we realized as MECQ and ECQ came in that we really need the health manpower backup that we have, and that it is safe to allow clinical interns to continue going to hospitals. The requirement is that they will not be sent to the portions of the hospital where there are COVID activities. So that's the requirement. But it can now be done in all parts of the country.
Sir De Vera, what are the major changes that university and colleges, or college administrators rather, should expect, again, amid this new quarantine system?
No, there's nothing that changes because the guidelines for limited face-to-face has been implemented since January this year. So schools have to apply in CHED at the regional offices so that they'll be allowed to do limited face-to-face. They are inspected in terms of how they retrofit their facilities, how they address directional instructions and minimum health standards in the campuses, in the rooms, study the airflow, study other activities that they have. And it is a joint CHED, DOH, IATF, and local government inspection that is done. And if they pass the inspection, they're allowed to have limited face-to-face classes in medical and allied health sciences. So that has been ongoing since January. So there's no change in terms of how they should retrofit their facilities, what they need to do. The only change in the new guidelines is to allow it for clinical interns, those who are really finishing their medical and nursing programs in ECQ and MECQ areas. So that's the only difference. Otherwise, the guidelines are the same since January of this year.
Mr. De Vera, would like to know also, are schools and administrators will be given authority to decide on certain matters regarding their students?
Well, the way they will run their programs, of course, is determined by the administrators themselves. We have already approved in the Commission and Bank flexible learning syllabus and curriculum for more than 20 degree programs. So not just in medical and allied health sciences, but also in engineering, in HRM. Last week, we approved those in maritime programs and vet med, etc. So if the President approves the expansion of limited face-to-face to cover other degree programs, the guidelines are ready, the flexible curriculum and syllabus is ready to be implemented by administrators. So there is a flexible curriculum and flexible syllabus that they will use in determining the appropriate mix of online, offline, and face-to-face activities of their students.
Sir De Vera, we certainly hope it won't happen, but just in case there will be, let's say, an outbreak in higher educational institution, what assistance can CHED actually provide?
No, it's not. Nobody can predict that there will be no outbreak in any facility. What we have are guidelines to make sure that if an outbreak happens, it will be addressed immediately. Out of the more than 10,000 students who are allowed to do face-to-face classes in medicine and allied health sciences, the infection rate over the past half year is less than 1%. It is 0.3%. Only 41 students out of more than 10,000 got infected. There are no casualties. They were all asymptomatic. Nobody was sent to the hospital. And out of more than 1,000 faculty members, the infection rate is 1.4%. That is within the manageable limit because there are no casualties, nobody got hospitalized, they all were asymptomatic. That means our guidelines are working. So if there is an infection, there are steps that the school should do in the 24-page guidelines on how to address an infection, including making sure the infected students or faculty are immediately quarantined. They coordinate with the local government in case there is a need to be quarantined and hospitalized. These are part of the requirements for opening face-to-face classes. 76% of the students who are doing face-to-face now have been vaccinated, and 85% of the faculty have been vaccinated. So there is an additional layer of protection that we have already put in place.
Just a final question, Sir De Vera. Again, can you walk us through very quick on the necessary measures that universities and colleges should be taking in place to ensure again the safety among their students and their school personnel?
Well, first, the schools must comply with minimum health standards as required by the Department of Health guidelines. Their facilities must be retrofitted. They must have a mechanism to work with their local governments in case there's an infection. They should have facilities in the university in case students or faculty members get infected. The retrofitting of their facilities must be complete, and they are monitored through our regional offices. So in instances over the past months where there have been infection, what the schools did was to temporarily close the classes, address the infected areas in the school, sanitize it, check on the health of the students. All the students doing face-to-face have PhilHealth. As I said, 76% of them have been vaccinated already. I would say that compared to other economic activities and other sectors of the country, the infection rate in higher education is one of the lowest, if not the lowest. It's less than 1% of more than 10,000 individuals.